Ahí está. Yes! Dr. Fauci! So, first question. Which of the COVID-19 vaccines have been officially approved by the FDA?
3 of them. One from Moderna, which is the mRNA vaccine. One from Pfizer, which is another mRNA vaccine. And the other one is from J&J, Johnson & Johnson, which is a little bit different. It gives the same kind of response, but it's a little bit different. So there are 3 vaccines that have gotten emergency use authorization from the FDA so far. There are a couple of others that are still being tested to determine if they're safe and effective, but the 3 that I just mentioned have been shown in very large clinical trials involving anywhere from 30,000 to 44,000 people per trial, were shown to be not only very efficacious, but quite safe.
Okay, so I asked if it was approved by the FDA, but I think that it's a different thing that an emergency use authorization than an approval. So what is the difference between an emergency use authorization and an official approval by the FDA?
Yes, that's a very good question. So an emergency use authorization is based on the criteria if the benefit clearly outweighs the risk and that you get a good degree of efficacy and safety. The full licensure is when you follow it for a longer period of time and you get more information and data. I have no doubt, given how very, very efficacious all 3 of these are, that they will ultimately get the full authorization in the sense of what's called a biological license approval. But an emergency use authorization is really quite of an important step in the direction of getting it the official approval. So let me give you an example of how much confidence I have in the emergency use authorization. I myself got vaccinated with one of those 3 vaccines.
Okay, so but if the vaccines are safe and effective, why hasn't the FDA given any of them the full official approval and license?
Actually, Eugenio, that is a very good question. There isn't like they have any problem with it. It just takes logistically a long time to get the approval. So when this is such a good product that you want to get it to people as quickly as possible because it's life-saving, you give it what's called an emergency use authorization. Not that there's anything less effective in it. You just takes a long time to get the full approval, and rather than deprive people of getting a life-saving vaccine before all of the I's get dotted and the T's get crossed, they give it an emergency use authorization based on a lot of solid data that it works.
What is the medical and legal responsibility of the companies that are making the vaccines? What happens if secondary effects are seen, let's say, in 5 or 10 years? Can I sue the manufacturer of the product if it hurts me, or if there's long-term effects years down the road?
There is a fund that allows the compensation for injury, but I have to tell you, Eugenio, that it's very, very, very unlikely that you're going to have an effect 5 or 10 years down the pike. The reason we say that is that we have decades of experience in the field of vaccinology, and virtually all of the effects, if they even occur, and they're very rare, occur within 15 to 45 days following the dose. Each of the companies had to wait 60 days before they were able to release it to be given to the people, because the most of the bad effects, if they do occur, and I say it's extremely rare, they almost all occur between 15 and 45 days.
Governments around the world are taking the liability, governments, but I'm talking about the manufacturer. If there's a problem, can I sue the people that made the vaccine, not the government, the people that made the vaccine? Because I've heard they are protected from liability.
They are very sensitive about hurting people, but you can sue anybody you want to sue. There's no guarantee because it will be in a court that would decide whether or not you get compensation. But we have not had any issues with that in any of the other vaccines.
But if I sue the manufacturer who pays for that, for that is the government, not the company, is right?
Right.
Okay, got it. So I've heard that even if healthy people have a very low risk of dying from COVID, they should still get the vaccine so they don't spread the virus to people who might be too old or too sick to get the vaccine. Is that true?
That's absolutely true. So an example, if you're a young, healthy person, statistically, the chances are that if you get infected, you're not going to get seriously ill. Who's getting infected? They have serious consequences. So you have a personal responsibility and a societal responsibility to protect yourself from getting infected.
The vaccine lowers my symptoms, but it may not prevent me from being infected with SARS-CoV-2, which means there's a possibility that I can still spread the virus even after I receive the vaccine. Correct?
That's the reason why That's the reason why we ask you to wear a mask after you've been vaccinated. But the evidence is accumulating that the level is very low risk that you transmit it to someone else.
You still can get infected and you can still spread it. So I thought herd immunity works because by being vaccinated, I block the virus from spreading to other people. But this vaccine may not do that. So how does herd immunity work if I can still spread the virus even after getting the vaccine?
Now, but the fact is the vaccine protects many people from getting infected.